Not normally. They may cost less than an in-person visit, but most doctors will still charge for them unless there's some special arrangement that they make with an individual patient. Thankfully, most insurance companies these days will cover telemedicine visits in some context. And if you're uninsured, there are also practices and services that will also provide telemedicine to patients that need to cash pay as well. Hopefully affordable. So we basically meet HIPAA standards. I'm not a cybersecurity expert, so I can only parrot what I'm told by the people that actually do software and technology. But we have 256-bit encryption, and then things about the structure of our application and where things are stored and how they're stored are intended to meet all the security standards required by HIPAA, and then also beyond that to just meeting modern cybersecurity standards. But I can't give you more detail than that because I'm not the expert. Telemedicine doesn't work in a few instances. One is there are some conditions that really are just better assessed in person. A lot of those have to do with things like a musculoskeletal hands-on exam where the doctor really needs to feel a certain thing to be able to tell what the diagnosis is. There aren't a long list of those, but some do exist. And there are some that come into the world of physical medicine rehabilitation. There are some in the world of neurology where this may be the case. And I can't say that it's impossible to assess you not using those techniques, but it might be easier or more efficient for the doctor to make an accurate determination if they have you in front of them and they can actually see you in person. So that's probably one instance. And then there are some other areas, for example, there are certain types of critical emergencies or things along those lines where you may need a procedure to be done or a surgery to be done, or you may need to be intubated, meaning they'll put a tube down your windpipe and put you on a ventilator. These kinds of things obviously can't really be done virtually, at least not at the moment. And so that's an instance when an in-person visit would make sense. As a result of that, if you want kind of a general rule, what we would say is, if you feel like you are critically ill and going to die right now, that's one where you call 911 or you go straight to the emergency room for that, because they may need to do something to you to keep you alive. Most other problems, including hospital care and various other things where things are kind of under control, you don't necessarily always, you may still in some cases, but in many cases you may not need an in-person visit. A virtual visit may work. And the reason it may work in the hospital is because, okay, you may still need a procedure done there, but you're surrounded by nurses, other staff members. So even though the doctor is not there, the rest of the care package is there in person, and they can do the things that may need to be done to push your care forward.